Welcome again to tonight's webinar. Tonight we're going to be discussing rehabilitation following arthroscopic rotator cuff repair. What we'll do is talk about a number of different topics related to the rehabilitation. Specifically, we'll discuss a little bit of the progression that we've made recently from the open to mini open to finally arthroscopic rotator cuff repair, as well as several principles of rehabilitation and a little bit about the outcomes that we will discuss at the end of tonight's session. So when we talk about rehabilitation following rotator cuff repair in general, our programs over the last probably half decade to full decade have changed, slightly more aggressive in nature. And aggressive is probably a bad word. I try to refrain from saying aggressive because it definitely doesn't have it may have a negative impact to some of our patients or physicians' perspectives in terms of our rehabilitation programs, but we have accelerated our programs for really two main factors. One is our surgical techniques that our physicians are using are definitely more advanced. We're seeing stronger fixation methods, and obviously we're going to relate that to a little bit different in terms of their rehab progression. People will be able to rehab a little bit faster if our fixation methods continue to improve, and obviously with the progression from open to mini open to even arthroscopic now, the amount of deltoid involvement or the ability to go through the deltoid without involving it within the surgery has certainly helped us speed up our rehab progressions as well. For those that may be newer to the field of rehabilitation and haven't experienced rehab of somebody with an open rotator cuff repair, a full open, not a mini open, but a full open, actually involved taking down the deltoid. So there were a lot of post-operative precautions just from that, taking off the deltoid and reattaching it alone. The second thing that I think is pretty important, though, for our rehab progression is that patients are becoming more active. They're becoming more active in the later phases of their lives. So we're dealing with patients that are probably more active and have more functional demands than we have in the past. So we have to match that with our rehabilitation progressions. Over the last decade or so, we've seen the transition from mini open to arthroscopic procedures, and this is just a little bit of a quick quote from an article published in 2003, and you can see just from the 5 years leading up to 2003, arthroscopic procedures were up about 20%